Good morning, I hope this finds you well. Noreen and I have been asked to make a short video just to update you on what's happening in our lives at the moment, both at home and at work. If I could start, as you know, I'm a local GP, and the first point I'd like to make is that general practice services are open for business. We are, of course, working in a very different way, with a significant reduction in face-to-face consultations, with the alternative of telephone, video or e-consult available. We are still seeing people on a face-to-face basis when absolutely necessary, and we are also still delivering home visits when absolutely necessary. We also have to think of our staff at this time who need to be supported and protected. Unfortunately, we do have enough PPE, which is very good indeed. We also have to adhere to social distancing rules within the buildings, so it's been helpful to have two sites in line, which has enabled us to do that. We do want to hear from you if you have a new medical problem that you would normally be contacting us about, because there is some concern that people are not presenting. I'll ask Noreen now to update on mental health.
Hello. For those that don't know me, I work as a nurse prescriber in Bridport Community Mental Health Team. So I'm going to work as usual. I go into the office 2 days a week. The main difference for me is that I'm doing less face-to-face contact with patients. The majority of my contacts at the moment are done by telephone or through Skype. I do still see patients, if necessary, face-to-face, if that's part of their treatment plan, that they have to have that contact, or obviously if somebody's in crisis. I would say that most of our patients are coping very well with the changes, with the restrictions, in particular patients who have anxiety, stress, and as part of their treatment plan, they tend to go out most days. They go out with a support worker, go for a coffee, have that sort of social contact. Obviously they're unable to do that at the moment, so it has been more difficult for them. What we do have though is lots of support available, and that's provided by our Dorset Healthcare Trust and also by organisations, for example, Anxiety UK and Mind. So we have lots of information that we give to patients to help them manage their stress and worry at this time. If there's anyone there that would like some information, then please do get in contact with me and I'll gradually pass it on to you. I suppose thinking about highlights at the moment, I think what I've seen that has been really heartwarming is the sense of community in Bridport. People from their own front rooms are organising food parcels, shopping, picking up prescriptions, telephoning, identifying vulnerable people, keeping in contact by telephone, and contacting services if they are concerned about someone.
So in the wider Dorset, it's very good that we really have quite a low instance of COVID-related disease. I think this is largely due to a high adherence to the social distancing and isolation rules. It's critically important that as any rules are slightly reduced, we don't then start congregating in large groups, so we do not create a second surge in disease. Noreen's going to update now on what's happening at home.
Okay, so we're fine. We're busy, but yes, we're fine. It's can be a bit worrying at the moment, but we tend to be sort of get through things and coping. Family-wise, our older son Martin, he lives in Chertsey with his wife Rebecca. They are both working from home. They're fine. Here at home we have Matthew and Jennifer. Matthew is currently completing his postgraduate and is due to start his exams in June. And Jenny, she is in her final year at Cardiff University and her exams start next week. And they're both studying, we think. But yes, so we're all well and we're healthy and feel very lucky.
So I've been asked to mention any lighter moments, and there aren't many at the moment, to be honest, due to the seriousness of the situation. but we did have one incident where one of our local doctors returned to the surgery finding the door to be locked, because that's what we've done to limit the footfall. So he then marched through Lloyd's the chemist in his full PPE gear, which, as you can imagine, caused quite a stir. But fortunately, normal service has now resumed. And finally, we were asked to mention just what we might pray about and think about at this time. First and foremost, of course, it's about the safety of everybody, isn't it? And that must be foremost in our minds. It's also a time to think about our neighbours. There are many people living alone, and if you could just lift the phone and check that they're all right, I think it's really important just to offer that level of support when people are spending so much time in their homes. And we also need to think of the other vulnerable people, both old but particularly the young, for whom home might not be the safest or securest environment. We need to just be thinking about them also. And finally, on a personal note, I lost a dear colleague last week. He was a GP in Dorset for 30 years and had been involved in many projects outside of his practice. And I would ask that we just think about his family at this really difficult time for them. So finally, we couldn't finish without just reminding everybody of this message. So please, stay at home, protect the NHS to save lives. Thank you for listening. Keep well and enjoy the rest of your day.